You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is a program called Food for Life, and it's our pleasure, as always, to have in the studio Heather Barrow from Food for Life. How you going, Heather?
I'm doing well. How are you doing, Hen?
Well, all the better for seeing you.
Yeah.
And today's topic is what?
Today's topic is signs and signals that the body gives that something might be out of balance or needs support. So pretty much the things that I look for in a nutrition consultation.
Mm-hmm. Okay, but before we get there, just remind our listeners we want to come and see you for some advice on how to keep healthy. How do we do that?
So I have a brand new website. Check it out at www.foodforlife.co.nz. You can ring me up. You could email me at heather@foodforlife.co.nz. Always happy to have a chat.
Indeed, and you can visit the Radio Kidnappers website, www.radiokidnappers.org.nz. There's a whole host of Heather's programs available for you to podcast and listen to you at your leisure, and you're also up on our YouTube channel as well.
Fabulous, yeah.
So that is good. Okay, signs and signals that our body is trying to tell us something. Tell us all about that.
Yeah, so I think a lot of us just go through day to day, week after week, and we start thinking that maybe that skin condition's normal, or the fact that I'm waking up at 2 a.m. is normal. You know, we just start to normalize all those little things because we don't really know what they mean. In my study, we learned, what all those signs and signals mean in the body. And oftentimes, it can mean that an organ needs some support, it might be a bit sluggish, that we're lacking in certain nutrients, our digestive health isn't working so well, our thyroid might need support. There's a lot of signs and signals, hundreds I would say, that the body can give.
I suppose some of the main ones, though, I've been doing a bit of research myself, and I came up with a list of probably 8 or 10 that might be worth talking about, because I'm sure they might refer to just about everyone who's listening to this. And for instance, the number one that I came across was hair loss. I mean, what would be the reason that we might lose our hair, nutritionally speaking?
That's a really good question. I think one thing about hair loss is it can be genetic. So is it your father's father?
That's right.
Yeah, so it skips a generation.
Blame him.
So I think that would be the number one reason is genetics. Yeah. But another one can be under-functioning thyroid. Yeah. So if your thyroid is hypo and not working as well, so it's a bit sluggish, you can have hair loss, and even the outer third of your eyebrow can be you can start losing that hair.
I also read that it might be a lack of vitamin B7.
B7 specifically. Okay, I've heard B vitamins, but interesting, B7. Okay.
So how would we remedy that, nutritionally speaking? What could we do to? I mean, what is it? A lack of a certain type of food, or?
Well, my first thought is it's a lack of nutrients in general, because obviously you need vitamins and minerals to support good health, good skin, good hair, strong teeth, bones, nails, all of that. So yeah, B vitamins, obviously all of fruits and vegetables, leafy greens, nuts and seeds, all really high in your Bs. Yeah. But of course, there's so many other factors to look at as well.
Indeed. What about cramping? Every now and then, I like my legs, my calves in particular, or my feet almost bend over, and you've got to get out of bed and you've got to walk around for about an hour. Again, night cramps they're quite common, aren't they? Is that a sign that my body's trying to tell me something?
Absolutely. So lots of different signs there. One, you can be dehydrated. So I think people get cramps, a lot of people that work out in the gym pretty hard. Yeah. People that are highly stressed get cramps a lot too. It's associated with a magnesium deficiency. So, we use up magnesium when we're stressed. The body uses it quite rapidly. It's a mineral that we use quite rapidly anyway, so it's actually good, to supplement with magnesium. If you're getting cramps, in your calves and your feet a lot, those are the most common places anyway. I would start off by supplementing with about 500 milligrams of magnesium at night to help you sleep.
If we didn't want to take a supplement, how would we get the extra magnesium from our diet, or is it we're just not getting enough?
Magnesium's one I think that we probably don't get enough of because our body uses it so much as well. So it's one that we have to keep pouring in a lot of. I think it's one of my top supplements would be magnesium for most people.
Okay, now you touched on it lightly when we first started the program, that we can get skin irritations. Let's call them, for want of a better word, a rash. What do rashes tell us about our body?
Well, the skin is an outward sign of what's happening internally. So chances are, it could be down to your gut health. There could be something going on in the gut, from yeast overgrowth to bacterial overgrowth, inflammation in the gut in general from poor diet or stress. Rashes can also be from food sensitivities. I often see that in little ones. So one thing I usually recommend is getting a food sensitivity test done, which I often do through hair because it's the most affordable.
Yes.
So it tests over 150 different foods that you can be sensitive to, as well as anything in the environment. And they've now even added testing for bacterial and yeast overgrowth in the gut as well. But oftentimes with skin issues, eczema, it's a matter of finding out the food sensitivities, removing them, and doing some gut work. So normally something's going on in the gut.
Are rashes like age specific? I mean, when we were growing up, fortunately I wasn't one of those people who got pimples or acne growing up, but it seemed to be the norm for teenagers to get acne. So is that just part and parcel of growing up, or are we talking maybe someone who might be a bit older getting all the stuff which you should have had when you were 15?
Yeah, I see all ages, breaking out with acne, but yeah, a lot of teenagers, and usually, especially male teenagers, they need a lot of zinc, and they're using a lot of zinc as well. So it's always a good idea if you have a teenage son at home, even daughter, get them to start supplementing with zinc. About 40 milligrams.
Okay, one of the other signs and signals that our body might be going to the pack is numbness. Do you get numbness?
I don't get numbness, no.
I don't get it either, but apparently...
do you mean like...
it's sort of like your hand might
tingly,
go numb,
like they've fallen asleep? Yeah, I do get that sometimes, if you're leaning on your hand or something.
Is it just because you're resting on a nerve, or...?
Yeah, I think for some people it can be poor circulation. So again, those that have underfunctioning thyroid tend to have poor circulation. Not enough blood cells. So... circulatory foods would be really helpful for those types of people. So like warming foods, particularly now that we're in winter.
Yes.
Things like cinnamon, chai tea, really warming, get the body and the blood moving. Ginger is another great one. Fresh ginger root. Garlic is a good one. And even something called dry skin brushing. I know, right? What's that?
What's that? Yeah.
So you find that old-fashioned baby doll brush that
I remember those.
Your granddaughter has for her baby dolls. It's really soft bristles, and you start brushing from the ankles upward because that's the direction that your lymph flows. So lymph can be stagnant. There's also lymph massage. So there's practitioners out there that can do that, which is awesome. But you just start brushing from your ankles upward, and that just stimulates the lymph, which is right under the skin, to start flowing upward towards your heart and increases circulation and detoxification.
When you say warming foods, is that something specific as opposed to a hot pie? That's a warming food, isn't it?
Yeah, that's just warming because it's actually hot, though.
That's right. So what is the difference between a warming food and food that is just hot?
Yeah, so warming foods tend to get the body moving, for those that might be confined to a wheelchair or sitting at their desk all day, or just don't like to exercise. Just kind of stimulates the blood flow. So like I said, even spicy foods is another one if your gut can handle it and your mouth can handle it.
Another one of the top 8 signs that your body might be going to the pack was yellow in the whites of your eyes. Now, I would normally associate, say, yellow eyes with, say the likes of hepatitis, but is it much more common than a kidney or a liver disease?
Yeah, I mean, it could be associated with hepatitis because usually yellow in the eyes is a sign of liver issues, liver stagnation. And, I do... another test that I do, sign and signal, is a stress test, and I look closely in the person's eye as well with this little light here, and I try and or this one, which is also a magnifying glass, so I can look really closely, and I see if there are any little yellow globules or fatty deposits or anything, and usually that does mean I need to look a little bit closer at the liver.
Okay, and what would you be recommending for someone who, let's say they don't have hepatitis, what would be the cause of those yellow spots, and why is the liver not functioning 100% nutritionally speaking?
Yeah, I'd have to look at their whole diet, but number
Yeah.
one, you know, if they're on a lot of medications, that's a liver loader. You know, your liver has to process all that. Alcohol, lots of sugar, caffeine can.
Yes, or you can never have enough of
Too
that.
much of that can load up the liver. So looking at all those different signs, hormones, you know, if they're on hormone replacement therapy, the liver's got a big job in filtering all that stuff.
What about dental issues? I mean, I suppose if you've got gum disease or bad breath, or it could be that you've got a problem with your teeth, I suppose, but it
be.
could also be that you're lacking nutritionally, could it?
Yeah, so, well, gum disease is a huge one, so flossing is hugely important.
Yeah.
That can lead to gum disease and bad breath. So can bacterial overgrowth in the gut. Because one thing I look at, another sign is tongue examination.
Yeah.
Because the tongue is an extension of your digestive tract, you want a healthy looking tongue, kind of like a kitten's tongue.
Yes.
So you don't want any splits or cracks or coating, raised papillae, which are these little bumps, scalloping, which is along the sides, or furrowed tongue, like right down here. So going back to the breath, small intestinal bacterial overgrowth. Usually, if there's a sign of that, there can be some kind of coating on the tongue or
Yeah.
a yeast overgrowth. It could just be slight coating. It could just be towards the back half of the tongue. Yellow can be a sign of liver stagnation as well. Or if you just had a coffee, oftentimes your tongue can be a bit
Sure.
yellow.
Yeah. So what do we do? I mean, the average person can look in the mirror right now and look at that tongue chart and say, wow, my tongue is, from where I'm sitting, top left-hand corner, and it looks fantastic.
So your tongue right now,
Yeah.
at a distance, it looks a bit yellow. So you've had a coffee
I've
this
just
morning?
had a coffee just before you came in.
Okay.
I've had 4 coffees this morning.
4?
Yeah.
And we're at, what, 9:30? I would be wired. That's impressive, Ken.
You've got to be good at something. Okay, so from my point of view, I look at that and I say, okay, my tongue's a little bit yellow, and we just decide that it's from coffee. So is it a good thing or a bad thing?
It's not good or bad. I can't really answer that. But, well, actually, I can if you've had 4 before 9 o'clock. I think that might be a bit much. But, yeah, so your tongue looked like it had a slight coating on it as well. Coffee can be very acidic, and coating can be associated with the body being too acidic.
Yeah.
So remember, you got to alkalize and balance that out.
Sure.
With lots of leafy greens, lemon, lime, lots of water. There are also some cracks on your tongue.
Yes.
Which can be a sign of dehydration. So remember, 30 mils of water per kilo of body weight, and even more if you're having diuretics like caffeine, which you are.
Do we also need to take into account age? I mean, you know, as you're getting older, your body gets a bit more wrinkly, I presume. No one's got that taut body that we used to have when we were 17. So some of the things like the cracking of your tongue, are they just a natural progression of getting older? Or
Not that I'm aware of. No.
Can't use that as an excuse.
So you're saying the tongue, yeah, the tongue aging. I don't know. I've
Well, the
never,
tongue's aging as the rest of the body. I mean, you know,
Yeah.
look how wrinkly your skin gets as you get a bit older.
I don't think so, actually, because I've seen, a lot of elderly patients with actually some really nice looking tongues.
Yes, have you really?
And remember, it's an extension of your gastrointestinal tract, so
Yes.
I don't think that ages.
Okay.
Yeah.
So can we presume that looking at that chart that you have there, that nutritionally we could make our tongue look like like the good tongue?
Absolutely.
The cast
Your tongue can change all the time.
Yeah.
So, even women, their monthly cycle, the tongue can get quite pale, which is a sign of low iron.
Yeah.
So it's a good idea just to check out your tongue, every so often. If you don't know what all the signs and signals mean, come see me for Warren of Fitness.
Yeah.
This is just one of many things that I look at in a consultation. So the most common one I would say would be the central crack,
Yeah.
which indicates weak digestion.
Right.
Means you're not breaking your foods down quite as well as you could.
Wow.
Maybe you're eating really quickly, you're drinking with your meals, or you're highly stressed and you don't have enough stomach acid to break your food down.
Yeah.
List goes on.
Is there a universal supplement that you might be recommending to people that they take to sort of give them overall general good health, which might improve how we look there or not?
Good question. A general supplement. I would actually recommend the Miracle apple cider vinegar, which also comes in a tablet. Apple cider vinegar, it stimulates your stomach acids and gets it ready to break your food down, which is great because most people aren't producing enough because they're stressed. It's very alkalizing for the body, so it'd be good for you.
Yeah.
Balance out that coffee.
Sure.
It's also really good for your liver. Your liver really loves apple cider vinegar. So lots of benefits to apple cider.
And is that economical for the average person? I mean, a lot of remedies, for instance, let's say health-related or natural remedies, they can be quite expensive, can't they? So
They
you got to think,
can,
wow,
yeah.
can I afford to keep my body looking that good because I've got to spend so much money?
Yeah, absolutely.
So can you do that on a budget?
Totally. I mean, a bottle of organic Chantel apple cider vinegar is about $6.
That's pretty reasonable.
And it can be
isn't
found at Pack and Save, you know, and probably last you, a teaspoon or tablespoon before a meal, probably last you a good month.
That is good value. So you would do that every day, have apple cider vinegar?
Yep. So best time to really do it is 15 minutes before a meal. Get the stomach acids flowing, get it ready to break your food down.
Does it taste like apples, or does it taste like cider, or does it taste like vinegar?
A little bit of everything, but that's why I promote the Chantel brand, because I think it tastes the best out of all of them.
And indeed, this program is proudly sponsored by Chantel's in Napier, isn't it?
Yes, it is.
So if you're looking for good, healthy food, get yourself over there. You probably touched on it slightly with the tongue there, but I was reading also that if you've got cracks in the corner of your mouth, it's a sign that your body's not...
Cracks in the corner of your...
Yeah, right in the corner of your mouth where you're
okay. I'm not sure about that one. Do you mean like cold sores?
Oh, I suppose so.
Yeah, so that usually means immune's a bit low, immune deficiency. So things like zinc would be a good supplement, selenium would be a good supplement, maybe a probiotic as well.
Yeah.
Just means you're run down, really.
Sure. I wonder what about sudden food intolerances as a sign that our body isn't functioning properly, because that one day you can think, oh, wish I hadn't had that pork. Is that a sign that you're becoming intolerant to foods which you've eaten for 60 years, and all of a sudden you think, wow, what's going on?
Yeah, I get that a lot, actually. I don't think suddenly an intolerance, you're intolerant to a food means you're going to be, intolerant forever. I actually don't believe that. I believe there are some chronic intolerances and sensitivities that stick with you. Like for me, all dairy.
Yeah.
My whole life, it's been all dairy.
Right.
I blame my mom, but that's another story. But I think depending on your gut, the state of your gut health, again, coming back to the gut, has a huge influence on your food sensitivity. So, if you're really stressed, drinking a lot, your gut environment changes, you can start reacting to foods that you never did before.
Yeah, exactly.
And then once, the gut is looked at, addressed, and healed, then you don't have those sensitivities that you once did have.
What's the difference between a food intolerance and an allergy?
So an allergy is very obvious. So, most common ones are like peanuts, kids' schools, you can't even bring nuts in.
No.
Anaphylaxis release, throat can close up, you can break out in a rash, welts, it's serious and it can be life-threatening. But food intolerances, pretty much what they do is they stop you absorbing the nutrients from your food as well as you could.
We've talked about it before, about peanuts. You mentioned that you can't even take them to school, but when I was a kid, everyone had peanut butter sandwiches.
Hey, I'm American, PB&J.
Exactly.
All the way.
What's happened?
Yeah, I don't know. More allergies, more sensitivities coming out there. I think our food's changing. I think our environment's changing, and we're just becoming more vulnerable and susceptible to those things. I think one of the best things you can do is take some time out for yourself, relax, spend time with family, slow down, enjoy your food, and try and eat food as nature intended.
Yeah.
If I were just to give some general advice, learn to recognize food as food and read labels, and if you can't recognize an ingredient, then your body won't be able to recognize it and break it down.
Indeed, although even some vegetables can get people going, can't they? Some people just can't eat necessarily some of the good stuff that you're recommending. Totally,
yeah. I mean, like an example of that is if you have arthritis, your nightshades contain alkaloids, which cause a loss of calcium and can cause pain and inflammation in the joints. So your nightshades like capsicum and eggplant and tomatoes, chilies, stuff like that. So not all healthy food is necessarily good for you.
Talking about signs and signals today that your body is maybe going to pack a bit, or you're not feeling very well because of what you're eating, but when does it become an issue for us? So let's just say that we get a rash come up. How long do we have to have that rash before we think, might go and see Heather?
Yeah, that's a good question. I guess it depends on the individual. Like just the other week, I had this irritation on my hands and it was really itchy. I've never had it before in my life. And I thought, what is this? And I tried all these creams and it wasn't working. And I thought, well, my gut's fine, you know?
Yeah.
So I just kind of waited it out and I didn't use anything and it went away. So I guess, I mean, I was on the brink of thinking, oh man, maybe I need to see a doctor, you know, but I didn't and it went away. So I think it depends on how uncomfortable you are, really.
So would you wait wait a week or 2 weeks or 3 weeks or a month or?
I waited about 10 days.
Yeah.
And I saw signs of it going away. So, you know, there's people that have issues for years.
Yeah.
You know, if you're struggling with a sore stomach to touch, you know, bloating, really windy, bowels are another thing I look at. You know, if you're constipated and you're not having a bowel every 24 hours, or if you're having mucus in your bowels or food particles or, you know, I wouldn't wait. I'd come see someone like myself and see what's going on because there's something, there needs to be some work done.
Indeed. Look, we're just about out of time. Just maybe quickly recap about signs and signals and remind our listeners if we want to come and see you, where are you?
Yes, so I'm located at G's Pharmacy in Taradale. You can pop in and see me. Go to my website, foodforlife.co.nz, or email me at heather@foodforlife.co.nz. Pretty much, if you're worried about something's come up, you have a look at your tongue and it, you know, maybe it's really scalped or cracked or there's a thick coating on it or it just doesn't look right. Give me a ring. Constipation, you know, if you want a full warrant of fitness where we're going to look, you know, even at the nails, the face, I'm going to do the stress testing, all those other tests, just give me a bell.
What's your number again?
It is 027-812-5071.
Good on you, Heather. As always, our pleasure. You look after yourself. We'll talk to you same time, same place next time.
Sounds good. Thanks, Ken.